There we go. Good morning, everyone. It is now 10:01, and I am going to call our regularly scheduled Las Cruces Economic Recovery Ad Hoc Board meeting to order. It is Thursday, August 20th, and we do have quorum, so we're going to go ahead and just call to order and get to the conflict of interest. If anyone has any conflict of interest regarding this meeting and this board, please do raise your hand at this time, and we will call on you and get that going. Okay, I am seeing none, so we're going to go ahead and move on to the acceptance of the agenda. The agenda was sent out to all. I hope that you got it. If not, you can find it in the email link with the Zoom. Is there any questions or discussion on the agenda, or I would entertain a motion to accept the agenda at this time?
Mr. Chair, I'll move to accept the agenda at this time. Ron Fitzherbert.
This is Michael
Thank
Harris.
you.
I'll second that.
Okay, so we have a motion by Mr. Fitzherbert and a second by Mr. Harris to accept the agenda as is. Is there any discussion on the current agenda as presented to us today? Okay, as I am seeing none, can I please get a roll call vote on the acceptance of the agenda as presented today?
Yes, Mr. Chair.
Thank you.
Ms. Debbi Moore?
Yes.
Mr. Michael Harris?
Yes.
Mr. George Miller?
Yes.
Ms. Sharon Thomas?
Yes.
Ms. Brooke Montgomery? Ms. Brooke Montgomery? Absent. Ms. Veronica Archuleta?
Yes.
Mr. Ron Fitzherbert?
Yes.
Mr. Doug Cowan?
Yes.
Ms. Susan Greenwald? Absent. Ms. Darleen Martinez? Ms. Darleen Martinez? Absent. Ms. Darleen Lopez? Ms. Darleen Lopez? Absent. Okay. Mr. Chair?
Yes, of course. Thank you. Okay, motion does pass for the agenda. Wonderful. Let me pull that up. Okay, moving on to the acceptance of the minutes from our ad hoc board meeting that was on the 13th of August. Those were emailed to you the other day. I hope you had a chance to read through them. It was a very long meeting, so the minutes are pretty long as well. So if there's any questions, concerns, or comments on those, now would be the time to raise your hand so we can address those. And I am seeing no hands raised. So that means that I would definitely entertain a motion to accept the minutes from the last meeting as is.
Mr. Chair,
Yes, ma'am.
Debbi
Ms.
Moore,
Debbi
for the
Moore.
record, I move to accept the minutes of August 13th, 2020.
Sharon Thomas, I second.
Wonderful. So we have a motion by Ms. Debbi Moore and a second by Ms. Sharon Thomas to accept the minutes of the August 13th meeting. Is there any discussion on those minutes from that meeting? Okay, and I see Ms. Lopez is joining us right now as well. So with that being said, I see no hands raised, so no concerns on those minutes. If I can please get a roll call vote on the acceptance of those minutes from the meeting last week.
Yes, Mr. Chair.
Thank you.
Mr. Michael Harris?
Yes.
Mr. George Miller?
Yes.
Ms. Brooke Montgomery? Ms. Brooke Montgomery? Absent. Ms. Veronica Archuleta?
Yes.
Mr. Ron Fitzherbert,
Yes.
Mr. Doug Cowan,
Yes.
Miss Susan Greenwald, Miss Susan Greenwald, absent. Miss Jolene Martinez, Miss Jolene Martinez, absent. Miss Darleen Lopez,
Yes.
and Mr. Chair.
Yes.
Thank you, Mr. Chair.
You didn't call my name.
I'm sorry, Sherry.
Yes.
Did Debbie move? Okay, I'm sorry.
Yes.
So Debbie.
Yes,
Okay.
yes,
I'm sorry, both of you. I did not call both of you. So Miss Debbi Moore,
yes,
Miss Sharon Thomas.
Yes.
Thank you.
Okay, motion does pass. Minutes are accepted. Beautiful. Okay, moving on. We're making great time, and I like that because last week we ran out of time. So we do have 2 discussion items that we did put on from the previous meeting, and they are the exact same, and they're going to be a more in-depth look and thought process of what we can do with those items and what action items there might be with those to bring to the city council and the mayor. So with that, we do have a presentation on the Las Cruces Safe Promise. It was asked by our vice chair, Ms. Debbi Moore, to present the marketing plan update, where it's going, how it's looking. So we do have that this afternoon, and then we're also going to talk a little bit about things that need to be added. I know Mr. Harris forwarded us a link to the Las Cruces Creative Connection, Las Cruces Creatives, I think, and we're going to look at that as well and see what we can all do. So let's go ahead and move into the update on the marketing plan.
Sounds good, Mr. Chair. Dr. Payares is not here, so I'll be making this presentation. So I'm going to be sharing my screen. If I can find that tool. Dominic, can you enable me to share? Oh, got it. I see it. Can you enable me to share the screen?
Yeah, 1 second.
Thank you, sir.
Go ahead and try it now, see if it works.
Yes. Can you all see the Las Cruces Safe presentation now?
Yes.
Yes, we're good to go.
All right. So it's going to be brief. We're ramping up the work that we are doing. Last time we talked about the actual logo having some issues with very similarity to a different logo for the department, for another city department. So we had to go back to the drawing board, and this is the design that it's now on the website. I'm gonna go on the timeline here. As you all know, July 24th was the day that the campaign was approved by City Council. That followed by a press conference in which you all were invited as board members with Mr. Chair and Ms. Vice Chair, sharing this message in a very upbeat and encouraging approach. So thank you for that. We also, because of the additional expenses, we went back to City Council to get additional budget that we can allocate for this campaign as a whole. And that was done on August the 17th. Up to date, we have had 3 City Council members that have taken the promise. So we're going to be asking that. Well, actually, we didn't only ask City Council members, but also we have requested all city employees to take the promise as well. We can report on those numbers in the next update. if you as board members haven't taken the promise, if you can please go ahead and do that, I think it would be a really good message to share with the public, as well as going through the New Mexico Safe Certified. I know that the Greater Chamber has gone through this, and we also requested from City Manager's office to have an institutional approach to this, and encourage all departments to do both the promise and the New Mexico certified. The New Mexico Safe Certified category that we would do is under office, as Madam Vice Chair had mentioned before. So we're working very closely with our community outreach department. You've met the lead in that group, her Jamie Rickman, and she is currently working on the development of content. That's going to be crucial, because this is where the behind the scenes work is being done to then push it out to the public outreach. And so we should be having something that we can start blasting out through the networks. As you recall, in the marketing plan, we had about 40,000 registered emails through the city as a whole, plus the business registration, and then through our partners. So once we have the content developed, that would be the first step, and then followed by the items in September. The utility bill inserts are under production currently. The decals for Las Cruces Safe Promise and the New Mexico Safe Promise are also, we're looking for a vendor to have those printed. And we already have the information of the businesses in Las Cruces that have taken the New Mexico Safe Promise, and I'll share with you that information shortly. So as soon as we have those decals, we're gonna send them out to those businesses for either the Las Cruces Safe Promise that they have done. Ideally, they would have done also the promise, but we would be mailing those out depending on what they have completed. And then next steps would be the business campaign with emails and radio. Radio still is a very popular way to send the message to the community. And so that's going to be a big effort that we're going to be undertaking, and making sure that everybody hears about this Safe Promise and they know the benefits of that, as well as the New Mexico Safe Promise or Safe Certified. And then we're going to be recording a public service announcement from each council member. And all of this information is going to be boosted through social media and the city's website. All right, so some numbers on the New Mexico Safe Certified. As of earlier this week, there were 30 businesses in Las Cruces that have gone through the certification program. If you see the total number of businesses statewide, this is quite a bit of the lower portion of the businesses. So I think there's a information gap there, and so the messaging that will start spreading will make hopefully a difference in terms of people knowing why this is important. And also a big important message to that invitation is to let them know that based on marketing research, customers are more intel to go to businesses who already have this certification training in place versus those that don't. So that should be a part of the communication message, and making sure that they understand the value of these programs. And that represents about 5% of all businesses in Las Cruces, and that's the breakdown by category. Because the Safe Certified program started through the New Mexico Department of Tourism, and with the initial intended clients as the hospitality related businesses, we see the bigger number being in the hotel and lodging. But even then, the numbers are pretty low in the rest of them. I was hoping that retail was a bigger number, and so that's going to be a big effort to let people know that this really will make a difference to them as well as the restaurants, because those are the two that are hurting the most, and anything that they can do to bring more confidence and invite customers will be important. And this is the list of businesses in Las Cruces that have, so the breakdown by category, this is the detail on who has been certified so far. So all of these will be receiving their decal for the New Mexico Safe Promise. And also hopefully they have made the Las Cruces Safe Promise, which is a much faster brief commitment to get it done. So this would be definitely part of our outreach to share with them the Las Cruces Safe Promise as well. With that, Mr. Chair, I open it up for questions.
Wonderful. Thank you for that presentation, Griselda. I really appreciate the update. I think that we're all on the right track. So if you guys can just go ahead and raise your hands if you have any questions. I see Ms. Lopez and then Mr. Harris. Ms. Lopez, go ahead.
Thank you, Mr. Chair. Griselda, I'm just wondering if how we can incorporate this, because the major focus on our awareness campaign right now is employers. Obviously, our hope is that if we have good employers, that's going to attract the job seekers, because the job seekers are looking for a way to get a foot in with certain employers. And they feel like, well, if I work with workforce, I may have a better chance of getting in there, on top of having some one-on-one support to make sure that my application and my resume is very strong. So we've taken an approach of focusing on having a really nice, diversified pool of employers that we have good relationships with. So our awareness campaign, our billboards, our radio ads, our materials that are being sent out, they're all actually going to employers. And I'm just wondering, like, all of our materials are pointing the employers to our Employ NM website. If maybe we can get the link on our Employ NM website. We can maybe, if there has been a webinar, or if there is something that we can do some type of a recorded webinar that we can post there under our virtual workshops, so that employers can get informed about what it is, how to do it, where to do it, and how it benefits them. Then we can, that can be another platform where we can connect employers to getting that done, and getting them the support that they're looking for right now from workforce. Is how do I get my business back up and running? How do I make sure I'm in compliance? This is going to be a really helpful thing for us too.
Yes, Ms. Darleen Lopez, thank you very much for those ideas. We can definitely get you that information and have a cross-reference as well from our website to workforce connections. So we keep making that connection. So we can definitely provide that information to be included. Thank you for that recommendation.
Thank you.
Okay, next is going to be Mr. Harris. Go ahead, Mr. Harris.
It's Michael Harris for the record. Yeah, thanks for the update. It looks like you guys are making some good progress on it. A couple of questions. One is there going to be a directory of the businesses in town that have taken this promise and or the New Mexico Safe Promise posted publicly on the website, other than the list that you just shared. And then the other one, which is somewhat related, is I checked yesterday and I just checked again today, and I don't see a link to the Las Cruces Safe Promise webpage anywhere recognizable on the city's website. So perhaps a reason nobody's done it is because nobody can find it without trying to go to it directly. So we should probably correct that also. But otherwise, yeah, I think maybe like a directory of the businesses, because the idea is that, you know, we want customers to know that these businesses are taking this seriously and have taken the promise and the trainings and whatever. So it would be nice to, you know, if you could go online and see if the place you're going to go has done it before you head out there. That's all. Thanks.
Mr. Chair, Mr. Harris, the New Mexico Safe Certified Program, they actually have a landing site with all the certified businesses. So what we could do is cross-reference that from our landing site and let them know. I'll have to go back to the technical team for the business directory for Las Cruces Safe Promise, because we intended to be a community-wide, not necessarily just businesses. I don't think that we discussed that item before. So that's something that we could look further into. One thing that we'll have to be careful with is that we are not, as the city, we're not perceived as endorsing any specific business through this promise. So we'll have to verify those two items, how to put it on the website, even if it's just links to their websites, and if that causes any conflict in terms of our internal policies. For the link of the Las Cruces Safe Promise, the easiest way that I was told to do, and this is what the message we gave in the press conference, if you go to the city's website on the search engine, if you type Las Cruces Safe Promise, that brings you to the site. So I'll talk to our communications office and see how we can make it more prominent.
Okay. Yeah, I was just looking to see, because there's the COVID-19 Alert Center, and there's a bunch of links here on the side. And actually among those, one of those is the eatery services, which is like a spreadsheet of a bunch of businesses. And I don't know, maybe there could be a column on there that cross-references that state database, as you said. But it seems like there should be a link there in that nav bar for our Cruces Safe Promise. But yeah, thanks for the update.
Yeah, Mr. Harris, we can check and see how we can make it more prominent and obvious to just click as you land on the website. We'll do some research on that.
Great, thanks.
Awesome. Miss Sharon Thomas.
Good morning, this is Sharon Thomas. I just wanted to mention that most of the city councilors have big email lists, and they send out information to their constituents fairly often. So was it possible to ask them to include this information when they're sending information out to their constituents?
Mr. Chair, Ms. Sharon Thomas, yes, I believe that the 40,000 figure includes those numbers. So we'll definitely, once the content has been finalized for EBLAST, we'll leverage upon those connections that city council members already have with the community.
And then there are a couple people in the community, Charlotte Lipson and Christina Little. They have very, very big email lists. So will you be sending information to them, or if you send it to me, I can send it to them, because they have huge email lists that they use all the time to keep people in the community updated.
Mr. Chair, Ms. Thomas, what we can do is once we e-blast it to everyone, including the board members, the ask is for you to help us distribute among your networks. I think that would be very helpful. And if you can include those individuals you mentioned, that would be very appreciated. But for instance, through the other non-for-profits here represented, I believe that that would be very powerful for everybody in this group to just share throughout the networks, and then ask for those individuals receiving from you information to share further.
Okay, thank you. I certainly can do that.
Awesome, thank you. Mr. Doug Cowan.
Thank you. This is Doug Cowan. We're making a statement, something to the likes of businesses that partake in this, that volunteer to get certified and so forth, are going to benefit. Do we have a way to somehow collect a data that would show that there's actually a favoritism? I don't know how else to word that, but a tendency for a consumer to favor participating with a business who is in this program versus giving business to one that is not. And the reason why I'm asking that is I think it would be very helpful if we could gather that data. And I know it's so new. I mean, there's just a handful here in Las Cruces for our Las Cruces Safe, and only 500 statewide in the whole state program. So I realize getting data this early may be a little tough, but is there a way that we would be able to collect data that shows that there's actually a benefit for businesses that are participating? Is there a way we can do that in some type of model?
Mr. Chair, Mr. Cowan, I'm sure there will be a way. It will have to be self-reported, where businesses cross-reference their promise to their increase in sales. I don't, based on the reach out effort that would mean for our department or for any other department, I don't know that would be the biggest return on investment, based on how to show the preference. I was talking to our marketing experts within the department, and they said that the industry trend showed that. So at this point, we will have to rely on secondary data of that preference. And as you mentioned, the numbers of businesses is still relatively low, and definitely very low in Las Cruces. So it would be hard to show those comparison figures, I would say. But maybe we could collect some type of anecdotal from the New Mexico Safe Certified and work with the state and see if they can share some of these success stories. But it would be quite a bit of an effort, because it will require primary collection of data.
Is that good, Mr. Cohen?
Yes, thank you.
Okay, wonderful. And then Vice Chairwoman Debbi Moore.
Thank you, Mr. Chair. I just want to react to Mr. Cowan's comments. One thing, Mr. Cowan, that we're doing from the chamber standpoint, because the city can't do this because of anti-donation, is as we see people, businesses signing up, we are going to be doing some videos that will be posted, and the city can share our videos, but they can't generate it because of anti-donation. And so that is something we are going to do. And certainly I've written down, we can work with the city to do one of our Friday Zooms on the certification process. And ironically, there was a step I was missing because we're not listed on the listing that they have of businesses. I missed the step, but that is something we're going to do as the businesses do that. Regarding, I think it's really important that not only that it be business centric to Ms. Lopez's comments, but we also really use our emails listings to include, in my case, encourage our businesses employees to take it. And certainly I think leading it by example on the individual, be safe. And I know, Griselda, correct me if I'm wrong, but I believe at yesterday's PRC meeting, we talked about actually, or at city council, somewhere there was some discussion about having like a sort of an I voted badge, but it's I'm safe, or whatever we can do with our logo from Las Cruces Safe. So I think that as we get people to look at it and do that. On the New Mexico certified, I actually have a certificate that says we're certified, that we have very prominently displayed in our door. So thank you, Mr. Chair. I just wanted to share those comments.
Thank you for that wonderful comments. And yes, I think Russell and I took the New Mexico Safe Certified as well. Sorry, I'm traveling. I was trying to find it. And we got the decal as well to put in our stick in our window at work. And that's what we'll be doing as well, to show that we're that out pretty quickly. I was very pleasantly surprised. So that was really good. And that's something that maybe we can add in addition to, you know, an online listing or a database or something like that that everyone's talking about right now. But maybe also giving the business and or the citizen something that like shows that, you know, people like tangible things to show that they did something. So that might be a really good idea as well. Any other questions, comments, or concerns for Ms. Martinez and or the presentation we just had? It looks like we don't have any other questions at this time. With that being said, we are going to move on to the next agenda item. Well, in correlation with this as well, we did kind of talk about last week about any like additions or anything else that we wanted to talk about under the Las Cruces Safe Promise. I don't know if anyone has any ideas or had any other discussion points on that. If you do, now would be the time to voice those and get those on the record so we can take a look at those and the feasibility behind that.
Mr. Chair?
Harris, yes.
Oh,
yes,
sorry.
ma'am. Oh,
sorry, I cut. He can go first.
Okay, go ahead, Mr. Harris, and we'll get Ms. Lopez.
Oh, sure. One thing that I had brought up a couple meetings ago and was suggested by maybe me or someone to put on the website is that the Cruces Creatives Makerspace is doing mask production and face shield production for people. And we're also organizing volunteers to help do those things. And so if we wanted to use the Safe Promise website as a vehicle for promoting, you know, nonprofits or other community efforts or places to get free masks and stuff, that's a resource that maybe we could put on there if it's appropriate.
Yeah, I know that. I think Mr. Francisco, which I don't see him on here right now, did respond to that, and he is looking into getting that done. So I think that is, like you said, a good vehicle to do that. Ms. Lopez.
Sorry.
Go ahead.
Mr. Chair and Mr. Harris, we are looking into that. The one point that we'll have to make sure is that we're not, non-for-profits are also subject to anti-donation issues with any governmental entity. So we'll verify that that's something viable from the legal perspective, and not conflicting with that as well. But thank you for the suggestion.
Wonderful, thank you. So I think that's something that we definitely need to look into then and see how that looks in the future to get those done, because I know we do have a nonprofit representative on the board. I think it's Mr. Cowan. So it's something that we can definitely look at and see what we can do with that. And then Ms. Lopez, I do know that you had a comment. So if you want to go ahead with that.
Oh, I just, Darleen Lopez for the record. I just wanted to see, I may have missed it. I wanted to know how to find where to get the their certification, the SAFE certified. Where can we find that?
All right, so we need to do some search optimization here. So if you go to las-cruces.org, you're gonna find a search area on the right side, and you can type in Las Cruces Safe Promise, and that should take you to the landing site for that. Please let me know if you do.
But that's just for the that's just for the SAFE Promise.
Oh,
now what about the certification?
Okay.
Yes.
So that is a state program.
Okay.
And you can Google New Mexico Safe Promise, and that leads you to their landing site. The site address is nmsafepromise.org.
Also, Ms.
Perfect.
Lopez, if you go on to the Las Cruces Safe Promise website, there is a link to the New Mexico Safe Certified website. And that's an easy way to get there too. And I just was on it, and that's how I got there.
Cool. Thank you guys. I want to add that to our website too. So thanks.
And Ms. Lopez, for the New Mexico Safe Certified, is the website is nmsafecertified.org.
Certified.org. Perfect. Thank you very much.
Wonderful. Okay. Any other comments, questions, or concerns about additions and or things that we can do with the Las Cruces Safe Promise, since that is currently jettisoning as we speak? Just raise your hand. Seeing none, I'm going to close that part of the discussion and move on to our next discussion item, which was mental health resources for workers during COVID-19. And that was also, we did 2 bullets under that, the resilience leaders, possible action items. And then also the biggest thing that everyone was talking about at our last meeting was childcare and a possible action item there. I don't see Jolene on right now, and I know that she was working with me on finding someone.
Mr. Chair?
Yes, ma'am. Yes.
We have Ms. Jean Resendez, and she will be helping us with that presentation.
Wonderful. Welcome. Thank you.
No problem. Do you,
Ms. Jean, are you gonna, can you share your screen, or would you rather us sharing it?
well, I don't have a PowerPoint. I'm so sorry. But
Not a problem.
I can go over that, and then I can always follow up and provide you guys any information, details, flyer, whatever that you might need. So I think Jolene was the one that reached out and wanted me to go ahead and present. So I can do that presentation now if you guys are ready. And then of course we can allow time for questions, because I know that that's probably what will be most helpful for you guys. So first of all, thank you for letting me join your Zoom. It's so nice to see so many people who are working towards the economic recovery here. Obviously a concern. We're focusing on the mental health of our community, and I just want to thank you guys for focusing on the economic development and recovery portion of that related to COVID. So if you're not familiar with Mesilla Valley Hospital, I'll just give you a quick overview so that way you know who we are, what we have available, and how we tie into all of this. So first of all, my name is Jeannie Resendez, and I'm the Director of Business Development at Mesilla Valley Hospital. I've been with the hospital for 12 years now. Sorry, do the math. It's been a passion of mine to work towards making sure that our community is aware of what services we have, providing that mental health support. So this is really a passion of mine. We are a psychiatric facility over on Del Rey. We've been there since 1987, so 30 plus years we've been serving the community, and we provide inpatient psychiatric care for adults, and then of course for children and adolescents. And currently we're serving that 10 and up age range. We are hoping to be able to provide services for kiddos as young as 8 years old. That's in the plan for later in the next month or two. So we have our acute psychiatric treatment programs, and that includes like anyone who's suffering from major depression, suicidal thoughts, homicidal thoughts, psychosis, and that includes diagnoses like bipolar disorder, schizophrenia, major depression disorder. And then of course, we also can treat dual diagnosis. So someone could have mental health concerns, but they're also suffering or dealing with substance use. So we can provide that inpatient detox for either adults or adolescents, but typically most of our detoxing patients are adults. And then to kind of provide that continuum of care for patients that need detox, we also have what we call partial hospitalization. So they come in, they do their detox, let's say for 5 to 7 days, and then they're going to step down into our partial hospitalization program. And that's like, they come in daily, or now since COVID, we can also offer them the virtual platform. So if they're not comfortable coming in to be in person for treatment, they can also participate via Zoom. So they would have treatment, just like we're having a meeting, they could come on and they would have their group discussions via Zoom. They would also meet with their like psychiatrist or medication provider, meet with their therapist, etc., just like if they were in person. So we have that program, and that's more of an intense group program geared towards substance use, and then of course our mental health patients too. Let me think what else. We also have, so our residential program for adolescent females, and those are kiddos that have been exposed or experienced some kind of trauma that requires them to be in longer term treatment. So that pretty much is kind of an overview of what we provide and how we serve the community and help the mental health needs of the community. Since COVID-19, of course, hit, we have been taking extra precautions, of course. So we implemented, just like most other folks, we have a screening tent out front. We screen everyone's temperature. We do a screening related to symptoms, travel, etc. So we have a separate tent outside where everyone who before they even come into the facility, they wash their hands, they get their temperature taken. Masks, of course, are required. And we're encouraging social distancing as much as possible. Consider we are providing psychiatric treatment in an inpatient setting. It gets a little bit challenging when it comes to patients and whether, to comply with their masks. and to comply with social distancing. However, that is our main goal. Our top priority is make sure that our patients are safe, our staff stays safe, so we can continue providing care. That was a major concern. Of course, just to give you an idea, when COVID kind of hit, March hit, we were still doing okay. When April hit, everything kind of tanked because, and what I mean is everything kind of dropped as far as volume and patients looking for care. Because most of our patients, and we serve the whole state, so most of our patients who come to us go to their emergency room first. And at that time, of course, everyone was scared to go out and get help, especially going anywhere near an emergency room for fear of getting contracting COVID or getting sick. So April was a little bit tough, but then as we were witnessing and knowing that people were isolated, they were staying home, which was a good thing. However, being isolated, not having access to mental health treatment, their medications, a support system, what we saw in May and June was a skyrocket in our need, specifically for adults. We were seeing the demand for adult services, and not just in Las Cruces or southern New Mexico, but we're seeing the demand across the state. Interestingly enough, we unfortunately we saw such a drop in our youth referrals for kiddos and adolescents. And that's definitely has to correlate with, the adolescents and kiddos not being in school. So no one necessarily observing them closely, maybe not seeing a counselor, social worker, whatever, not getting referred. And of course, parents being worried that coming into a facility, they could, be exposed to COVID. So anyway, so that's been a concern. As we're starting school again, we're doing everything we can to reach out to the schools to provide our support and let them know services are still available. I have a feeling as school starts, we will start to see an impact in those referrals and people seeking help for their kids and adolescents. So we're doing the best we can as far as COVID, and basically it's just business as usual. We are there to provide care. We remain open, everything functioning. We're just adjusting a little bit, just like everyone else. Definitely sanitizing more, extreme focus on all those safety measures. So just to give you a little bit of some info here, what's interesting and sad is, like I was saying, how a lot of people have been isolated and dealing with their mental health conditions. In addition, they're also self-medicating. So we have seen also an extreme increase in our patients needing inpatient detox and substance use treatment. So just this year, we've already seen an 88% increase in the patients that are needing detox services and substance use. So that's something to keep in mind. We all have to do our best to stay safe, do everything that we need to as far as COVID, isolate, social distance. We also need to consider that those who are isolating and trying to social distance are hurting, and they still need our help, and they're reaching out. Well, what I should say is they're not reaching out for help necessarily from their support systems, and they're self-medicating a lot of times with alcohol, drugs, and reverting back to unsafe coping mechanisms during this time. So we're doing our best to outreach and make sure people know that we're still available and we're there 24/7. They can walk in anytime and they do not have to go to the ER first. So anyways, that's kind of my overview of what we're doing and how we're serving the needs of the community, especially during COVID, and just wanting to make sure that everyone knows that those mental health needs and those substance use needs are still there. So should we open that for questions, or I'm happy to take questions because that's usually the best way that we can get information across.
Definitely. I actually have a few. And the reason why this is really concerning to me is, one, I think COVID is living in COVID times is a very traumatic experience, and it brings up trauma for a lot of people that, they're at home with their kids 24/7. And, I own a restaurant in town, and one of our first questions that we ask when we have a team member enter in the back door. We give them, some sanitizer. We ask them a bunch of questions. We take their temp. We give them their mask for the day that we take care of. And, it's always, how's your mental health? How's home? How are you dealing with this? Because if they're not mentally ready to take on the day and be there, then I don't think they should be there. Like, they don't need to go out of their ways if they're not mentally prepared to take on the day, right? So I'm really concerned because I know that a lot of our, I employ, most of my team is under the age of 40. And they're young. Some are in college, a couple are, seniors in high school. They're not seeing their friends. And, I have a couple youth that would classify as, the LGBTQ community, and they don't have good support systems at home, and they're not with their friends at school. So my question to you, and the question that I think a lot of business owners should have, hopefully, is what kind of resources are out there in our community right now that we can present to our team and our, coworkers and say like, hey, I know things are hard right now. Like, I get it. Here's like a resource that is within the community that isn't going to break the bank or isn't going to hurt them financially or anything like that. Is there any resources right now that is aimed at that?
So I'm glad you brought that up, and it's good that you actually noticed to and acknowledge the fact that we should be addressing mental health. It's kind of like that invisible. When we can tell if someone's kind of sick or runny nose, temperature, or whatever, those things are like those are hard facts, right? So mental health is a little difficult. As far as resources in the community, my whole thing is not just to say, Mesilla Valley Hospital is not the only option out there. We can be a resource though, in that people can call us 24/7, and they might not even need to be hospitalized, but we can provide resources like, we know that this counselor is available, this counseling agency is still open, this clinic is taking patients still. So we try and keep updated on what is going on in the community as far as what resources are available. And we do know that most of our mental health professionals that we partner with and that we work with, we refer patients to, they're doing a lot of obviously virtual appointments. And so that's become the norm. Most of them have not returned necessarily to their offices to see patients unless they're like with a like a community mental health agency, like La Clinica de Familia, of course. There's the Ben Archer Health Centers, and those are each federally qualified health centers. So if you're looking for resources for someone's like, oh, I don't know, or hey, my health insurance ran out, I don't have it right now, or they're just concerned about getting in time, because sometimes there's a wait. La Clinica and Ben Archer are really great resources for that. And they also have, psychiatrists available for medication management. They have counselors and therapists available. And if you look at some of those, like, especially La Clinica has, I want to say, for those who are dealing with chronic mental health issues that, it's not just, oh, I'm depressed. I go in for a little treatment, do some therapy, get some, maybe an antidepressant, and people can learn to manage. Well, we're talking about patients who need us for like severe conditions like bipolar disorder or schizophrenia. They have to have like a very structured treatment plan. And sometimes that might be like, hey, I have to go to the hospital, I get stabilized on my medication, and then I step down into a more intense program. And that could be with someone like, what I was talking about, our partial hospitalization program, or it could be like with La Clinica, who has like an ACT team, and they serve as case managers. So they follow up with patients. Are they taking their medications? So that kind of thing. So we can, if someone doesn't know, like, I don't know what to do, or you have a parent who's like, oh my gosh, they're just starting to observe some mental health conditions, or they start to worry, maybe their child is feeling suicidal. Maybe they're so disconnected now from their friends and their, goals. Maybe they just need to know, like, who do I call? And so I always encourage people that they can call Mesilla Valley anytime, and we can always provide resources to them, because what happens is not everybody who comes to us for an assessment has to be hospitalized, right? So we're going to have to provide them resources. So we always give them like at least 2 or 3 different resources that they can turn to based on what their needs are, maybe where they live, what their community setting is, what their transportation needs are, whatever that might be, we can always refer them out. And I can speak to you as, you know, been with Mesilla Valley 12 years, but I can speak to you as a parent too. So watching, my college kid just went off back to school, and I have a 9-year-old in 4th grade. And so I'm pretty sure I'm going to fail 4th grade. So just with virtual learning and the whole process is just a challenge. The only thing I can, you know, kind of makes me feel better is that, man, all the parents are going through this at the same time, right? But we're also going to see changes in our kids. We're also going to notice that they're not connected to their classmates right now. They're not getting that social interaction. And I mean, I get it. We have to be safe, first of all. But we need to know to watch out for those signs. Are our kids getting, maybe they're looking sad, they're getting depressed, it's not changing for them, they don't see any hope. I mean, these are things that, you know, even adults are feeling, and then we have to instill in our kids that, no, you know, try and be that positive, like, let's keep going, it will get better, we know. But there comes a point when you realize that they've probably gotten into a situation that's not going to change unless they get some actual help. And whether that means counseling or medication, that's something that has to be addressed. Like I said, we're trying to work with the schools as best we can on this virtual platform, and just continuing to maintain contact with all of our schools, all of our counselors, all of the social workers that work there, to know we're still there. And people, at the very least, if someone's worried about someone in a crisis, they can always just come to us 24/7 for that assessment. We can assess where they need to be, what they need to have, what would be the best plan of care for them. So that's kind of some of the options. I'm sorry, I hope I answered your questions, but I say if someone, I mean, at the very least, if they, you know, they just need that assessment to know where they are, or like, you know, I'm concerned about my husband, I'm concerned about my mom, they just need to at least reach out to have that assessment. And the assessment part is free, but, you know, at least we can determine like where they need to go. If they're so severe and concerned, you know, some people do end up going to the ER, and they feel more comfortable at the ER, because sometimes it's a huge step to make that decision. Like, oh, I'm going to go to the psych hospital, I'm going to get assessment. You know, it's not that easy. So we know that it's a huge, brave step for someone to actually come to our facility, get that assessment, or go to any mental health provider, right? So we try and make it as simple as possible. And then, like I said, if we're not the option that they think they need, I would always say to reach out to the Clinica de Familia, Ben Archer Health Center. There's several counseling agencies in our community too, A New Hope Therapy Center, Counseling Las Cruces. So there are resources, and I'm just naming a few off the top of my head. There's plenty of good providers in this community that are able and willing to take on patients, and they know that they're needed. So if we've seen an increase as far as, especially in our adult population and the substance use population, just us seeing that increase, we know that our mental health providers here are seeing it. And not only that, typically the first place people go for mental health care is going to be their primary care provider. So a lot of times they're like, I don't want to reach out for mental health. You know, I don't need that. So they'll go to their primary care doctor or their health clinic, or maybe even urgent care, because like I said, it's a huge step to take. Like, I'm going to go to a psych hospital and I don't want to be judged. And there's still that stigma that we're still trying to work on in our community and, you know, everywhere. So they may just present to their primary care physician. So even at that, if someone is willing to do that, then we partner with a lot of those providers too. So we know that we can actually be a resource and a step down as far as what those patients might need. So I hope that answers your question. Probably not fully, but if we have others, I can elaborate.
No, definitely. I think that was great, and I really do appreciate it, because I'm a huge proponent for mental health and therapy and all that great stuff. I think
Yay.
everyone should be in therapy, to be honest. But I think that's great, and it does give us like a resource as you know, someone that deals with people every day to say, you know, there's resources out there. Please go out there. And actually, I just went on A New Hope's website,
Oh, yeah.
and they actually have people that are working through COVID, and it's called Helping the Helpers with Pandemic Self-Care. And it's a workshop. So that's kind of cool that that's out there too. So I'm definitely going to start bringing that up to people as well, because
Yeah.
it looks great. It looks like a great training resource. So
Yeah,
thank you
and
for
they
that.
are, sorry, I didn't mean to interrupt you, but A New Hope Health Center, I'm familiar with a lot of providers there. They do a lot of good trainings. And so again, that's something that's been missing in our community too, is that, you know, having the training, having support groups, having those kind of things, it is something that we're kind of missing and people lose touch with. I will let you know that at the hospital, we're still able to host our on-site, in-person AA meetings. So that's something that we've provided at our facility for like 30 years. So every morning, 8 o'clock, the Sunshine Group is there. So they're hosting their AA meetings there, and that's their own group. We just host it. So again, that's another resource. If someone wants to connect, they get screened too. So they go through the whole process, but they do have their meetings there. We have other counseling groups that are doing trainings and maybe providing support for even the other mental health providers and the helpers and the medical workers here in our community. We used to provide monthly trainings to our mental health providers here, but during COVID, it's kind of hard to get all those people together. So we're looking at ways that we can do some online trainings too. And we're always open for that. And we have quite a big network. So too, we can work with, whether it's this board, the chamber, whatever, if there's information that we need to get out to these providers, I am happy to do that. I have, you know, so I'm happy to do that too. So it's all about connecting and maintaining those relationships. So.
Awesome. I appreciate that. Thank you.
Yeah.
We do have a couple more hands raised. Mr. Miller, go ahead.
Awesome.
Yes, George Miller. Thanks for being with us. That's a great service you're providing in our community where it's much needed. And I think you've covered most of the questions about for businesses, organizations. There's trainings we can do for self-care. I think that's real important. And what is if a business person or someone in the church or the organization sees, or a family sees some signs, you've kind of given your organization as a place for first referral. But is that really is there a hotline, or is that the, so I think you've answered much of that we can at least advise our organizations, but is there a hotline in the community for like an emergency first service, or is it something like that?
Yeah, so, and on a side note, I'll make sure everyone has my contact information and our own number, 24/7 number to call. We're not a hotline, but you know, if you need us, we can always answer questions. So as far as like in town, we do have I would say locally, we do have the New Mexico Crisis and Access Line that's available to folks, and that's across the state, but that would be one of those hotlines that would be available for someone if they just wanted to talk. I know that I was just, I saw on a social media post too, La Piñon is still going strong with their kids, the Kid Talk. And so they have that available. And I'm sure that's going to be one of those resources that we need to get out further, is the Kid Talk line, especially with kids staying at home and doing their work and needing someone to talk with. So, oh my gosh, I should remember this number, and I can't remember the number, but perhaps I can send that out when I do a follow-up email, and I'll send that out to get to the group. But that's one of those like hotlines or warm lines actually to talk with. So kids can talk to anybody about anything. It could be school, could be it could be relationships, it could be, you know, stress, it could be depression, whatever it is. And I've actually trained the people that man the phones, or, you know, answer the phones at Kid Talk. I've done several presentations there about suicide prevention. And so that's also something that I'm happy to provide too, is a training on suicide prevention for youth. And then I have another team member who's actually mental health first aid certified. Her name is Judy Baca, and we're working to get the mental health first aid certification for virtual training. So they're now doing, that because of course we're not able to do our in-person trainings, but she's an excellent resource. And Mesilla Valley makes that available to any organization who wants to have that training. And so as soon as we get online with the full virtual certification, then it's a training we can do no cost. And so it's just actually pretty perfect for anyone in the community. You don't have to know about mental health. You don't have to be an expert on suicide prevention. It's basically what to look for. Oh my gosh, if someone's doing this, if my kid's showing this, what should I do? Or if I'm at Walmart and I see someone, having some difficulty, what do I do? How would I interact? So that's a available service. So I think as far as like hotlines, there's the National Suicide Prevention Hotline, but we have our own New Mexico Crisis and Access Line. They are working, and you probably are aware, they're moving forward finally with the Crisis Triage Center, and moving forward to being able to actually run that center. Of course, that'll be a 23-hour observation kind of unit, but part of that and some other plans, we're looking at having a local on-call unit, and not necessarily tied to the crisis center, but another provider in town, and they're working on that. I think the city is working on that to try and see if we can have mobile crisis unit again. And so we've been in talks with those same providers and trying to just offer our partnership, but that's definitely something I think that we need here again. Many, many years ago, of course, we had the mobile crisis team. So the funding got taken away and things kind of got disheveled in the mental health system here and across the state. But mobile crisis team would definitely be a huge asset to this community to assist and kind of provide support to law enforcement or the fire department or whoever the first responders are reacting to that. So I kind of just threw in my plug, sorry, for our advocate for mobile crisis team, because we get calls. So for example, let's say we get a call, and even though we're not a hotline, we get calls from people all the time who are suicidal. Sometimes they give us a lot of information, sometimes they won't. So if they're not willing to have an assessment or come in or go to the ER or whatever it is, then we have to call welfare checks. So if someone is making a threat to harm themselves or others, we do our best to make sure that we're getting them the care that they need. And we work a lot. We work a lot with law enforcement. Recently, we worked with the Sheriff's Department for a successful intervention, fire department, Paul Ford and his team at the Integrative Mental Health mobile unit has been awesome, amazing. So those kind of resources in town are great, but sometimes we're not all connected and knowledgeable about everything. So I'm glad you're asking about that. I'm glad this board is like willing to entertain those ideas and get more education on that. So I certainly can provide more resources on a side, and I can remain a resource to you guys no matter what. I work closely with even Jolene through FYI, and I've worked with Cassandra Gandera, of course, on different projects for mental health. So whatever I can do to support this kind of group, because you're all seeing it too, whether you're in business, whether you have employees, whether you have kids, whatever. And so, yeah. Sorry, I kind of a lot. So,
Thank you.
yeah. There are other questions?
Mr. Fitzherbert.
Great. Hi.
Thank you. Ron Fitzherbert for the record. Great presentation. I do want to make sure I disclose first that I work for the third FQHC in town, Amador Health Center. So
nice. Yes, we work a lot with Amador.
Yeah, so just want to make sure everyone is clear that the FQHCs, all of us, are here to support everyone. We're the safety net. It doesn't require insurance. It doesn't require documentation. People who need the services have access to the services. So just need, make sure everyone can tell their employees, their friends, their families that it's not, that there is available services. So that's the main thing, just the comment that everyone can get service that needs it, regardless of income, insurance, or anything else.
Exactly. So I'm glad you spoke up, Ron. And I apologize for forgetting to mention Amador Health Center, because we actually work quite closely, whether it's referrals from the center or whether we are referring back to the center. We've worked closely. Prior to COVID, we were able to actually send out our mobile assessment team. And a couple of those times we were able to help, whether the client was through Amador Health Center, Community of Hope, any of those organizations, we were actually able to send out someone to do that mobile assessment. Of course, now we're a little bit limited, but the assessments are still available via phone or whatever the needs might be. So I encourage the community to utilize all of those resources, like you were saying, Ron, for all of our FAQCs or federally qualified healthcare centers, whether it's Amador, La Clinica, Ben Archer, whatever. Exactly, those are available for people no matter their availability to insurance or funding or whatever that might be. Those resources are there. As long as we encourage people to get help, the better. I think what happens is people get really, they just don't want to reach out for mental health, or they feel embarrassed, they feel stigmatized or whatever. So the more and more we reach out to groups like what you guys are doing, the better, because then we can encourage people to get help when we're seeing the signs. And again, it's not necessarily that someone's going to always need hospitalization. It just means that they need someone either to talk to, they need someone to kind of review their medications, maybe someone to help them get through a tough situation, and then connect them through resources. And that's something I know you guys at Amador do, connecting people with the resources that they need. And that's really the important piece, because we're only one piece of this whole giant puzzle, right? Someone ends up in a crisis, they end up in our facility and they'll be there 5 to 7 days, or sometimes our adolescent patients will stay there a little bit longer, 7 to 10 days, right? Or a detox is usually like 5 days, right? So that's like only a short period of time. What's important is that we connect with other resources for their aftercare. And so we're only a piece of that puzzle. And so we have to rely on our huge network of, well, it's not really huge, we need more mental health providers, but we rely on our network of providers in order to take care of the patients after they discharge. So sometimes that's the start of the journey, is their hospitalization. And then we have to make sure that they follow through and get the help that they need on an outpatient basis. So thank you.
Thank you. Thank you.
Yeah.
Awesome. Okay. Ms. Martinez, you have your hand raised.
Yes, Mr. Chair. Ms. Resendez, is your organization the one that has provided a training opportunity for community members? It was offered about 2 weeks ago, and I believe the next one was going to be available in about 2 weeks. We got the information from Mayor Pro Tem Gandara.
Oh, okay. I don't think that was one of ours.
Okay.
I'm wondering if we used to offer our monthly trainings, but we're trying to modify that for virtual. But I'm trying to remember who did a training recently.
Don't worry. I thought it was you, but don't worry. Thank you, though. Thank
you,
Mr. Chair.
But we're always willing to accommodate. So if you or anyone else you're connected with has found a need for training, just let me know, and we will definitely do our best to provide that. So that's another resource. I mean, we have those who are qualified to speak on those topics. And so if we can help, we're happy to do so.
I appreciate it. Thank you.
Of course.
Wonderful. I am not seeing any other hands raised. So if anyone at this time does have a question, please do raise your hand and we will go from there.
Okay. Yeah, whoever, and I can always follow up by email if you guys get questions later.
That would be great if we could get your contact email. We'll distribute it to the board. I think that would be really beneficial. And once again, like, we are an reopening the economy focused board, but I think a big part of that is making sure people have the proper healthcare, mental health, to go out back into the world and take it on and say, okay, I can be safe and secure in a environment. You know, it's one of those things, like, going out in COVID is very triggering right now for a lot of people. I can only imagine. So I'm excited to have you here today, and I really do appreciate it. I really do see this being a really helpful presentation today. So with that being said, thank you for joining us. I really appreciate you.
Of course. No, thank you very much. I'm sorry I didn't have a PowerPoint together, but sometimes I just like to kind of discuss things and take questions. So I appreciate what you're doing. We're going to keep doing what we do. And we'll, as we all ride this roller coaster, that just it's not ending yet, but we're learning to manage better. So I appreciate you guys being focused on mental health and giving me the opportunity to talk with you. So I will make sure that I've been in contact with Cynthia. So I will make sure she has all of my information, and then we can have any other discussions later or contacts later. We're always available.
Wonderful. Thank you so much. Have a great rest of your day.
Yeah.
Thank you.
You guys too. Have a great day, and thank you.
Thank you. Okay. So with that being said, that was a great little conversation that we had. A lot of good questions and discussion on that. I think it definitely gave us resources that hopefully maybe we can incorporate into the Las Cruces Safe Promise website, or even just in COVID in general website, and just so people know where to go. I think it's really important because I do know a lot of people are feeling lost dealing with COVID and going out in the world and, you know, trying to re-enter the economy. With that being said, we do have a part 2 to this discussion. It is 11:17. We do not have a presentation for this part, but we did have it last week, and it was something that we wanted to put on again. So I do want to go ahead and talk about that for a few minutes, and then hopefully we can get a couple other discussion items for future discussion. I know the Workforce Connection Scholarship is on there. We'll have any announcements, and then we'll try to convene the meeting as close to 11:30 as possible. So with that being said, let's go ahead and open up the floor to everyone. I know a lot of people on here was very, very concerned about the resilience leaders presentation that we had and an actionable item, and it seems like everyone was talking about childcare, and that was a huge concern. So I know a lot of you raised your hands last week talking about it. So let's go ahead and get that conversation started this week and see if there's any possible action item that we can look at to help the residents of Las Cruces. So I'll open up the floor. Miss Debbi Moore.
Debbi Moore, for the record, Greater Las Cruces Chamber of Commerce. Mr. Chair, members of the board, I will say I would recommend we might see if we couldn't get someone to do a presentation. I'm actually part of a committee that the Las Cruces Public Schools has put together to specifically address the daycare situation, childcare, before after school care, and during, with regards to the virtual at this time. And we have another meeting on Monday. I also have been informed that Boys and Girls Club is expanding. They have limited space, but they're expanding to be open basically all day for employees that can register their children to come, and actually they have a virtual learning center as part of that. At the present time, I can't think of any actionable items because we're still trying to get daycare centers that have not opened open, working with the state environment departments, public ed, early childhood departments, and the health department to see if potentially we could expand some of the daycare occupancy requirements out of the 25. That is iffy right now. And of course, as always, to see where we're going to be with regards with the 100% as we move into the yellow. So, Mr. Chair, I would recommend we might sort of table this discussion until we can actually have something to really hear about some presentations. Thank you.
I don't see any other hands raised, Mrs. Debbie. So if you can make a motion to table this for future discussion item for next week, we can definitely move on then.
Mr. Chair, Debbi Moore for the record. I move that item number discussion item 3 under a discussion topic number 2 on our agenda of today, that we table and look to see if we can get more people or some people to make a presentation.
Do we have a second?
George Miller for the record. I second it.
Any discussion on this at this point? Okay, so we have a motion on the floor to table this. Ms. Sharon Thomas.
Well, again, this is not immediate, but we're rewriting the 4-year plan for the Workforce Connection program right now. We have like 30 days to finish it. And one of the things that they do in the El Paso workforce program is they have a huge amount of money that they spend on childcare, preschool. And so it would be not, and I'm one of the people working on this, so anything that we can do a presentation on that can help me write more of that into our 4-year plan, that would be great, because workers, that's the big problem for workers, is to not be able to pay for childcare. So that's just the going forward item. It's not immediate, but we are writing the plan right now, and I want to get more information in there about the need for childcare from the Workforce Connection.
Mr. Chair, Debbi Moore, can I respond to Ms. Thomas? Thank you, Debbi Moore, for the record. Sharon, would that be, when you say rewriting, would that be state funding? But we could potentially recommend that city funding be, I don't know if it could be added directly to that. There could be some scholarships, but I would assume your conversation meant the state workforce.
Yes, this each of the 4 districts in the state, this Sharon Thomas, has to put forward their new 4-year plan, and we'll have this finished by September 15th, and it will go out for public comment. So I would be very helpful if I can tell this board when it comes out for public comment, and you guys can go and, you know, talk, make your positions and your wishes known. It is federal money that comes through the state. It's quite a few $1 million for all the workforce programs, but we don't spend very much on childcare at this point, especially not compared to El Paso, where their childcare part of the budget is the biggest part of their budget.
Thank you, Mr.
Awesome.
Chair.
Thank you. And Ms. Lopez, you do have your hand raised as well.
Earbud wasn't plugged in all the way. Thank you, Mr. Chair. Darleen Lopez for the record. I just wanted to kind of give a little bit of insight on what the real root of the issue is here. And I know that it may be a bigger challenge or a bigger issue than what we have the power to move. But I just thought I would throw it out there that the biggest challenge is room. A lot of these daycares and pre-K buildings are tight. They're pretty small. They go in with the intention that these are little people. They're little humans. We don't need that much space. But now in this new world, we need the space. And so even though some of them want to reopen, you know, they're having that challenge because they're saying, you know, how many kids can we really have in here and be able to maintain the social distancing and adhere to the public health orders? And is it worth it to bring staff back at that rate? You know, if we only have 5 kids, you know, can I really pay, you know, 5 staff members to do the books and to actually take care of the children and actually, you know, preparing meals and all the other things, lesson plans that they would need to do. And, you know, I got a little taste of it. My daughters, I registered them for a Zoom cheer camp. And then I registered them for another camp, and I didn't realize it was in person until like the last minute. And so we went up there to the facility, and you know, the parents weren't allowed in there because of social distancing, and there just wasn't enough space. But the report back from my older daughter for the younger daughter was that they were having a significant challenge keeping the little ones from forgetting that they need to social distance because they're small and they forget every 5 minutes. And so they were having this really big issue, you know, maintaining that, not only because it's hard with little kids, but also because they just didn't have enough space. I think that for a little child, they probably need to put 10 feet between them in order to keep them at 6 feet, you know, and it was tight in there. And so I think that a lot of it may have to do with that. So maybe repurposing some space, maybe working with the city, you know, to utilize some space for the daycare providers that they could spill over into a different space and be able to have more kiddos. So, I mean, that's just kind of something I was thinking that may be helpful to them because some of them just don't have the space. So those are my thoughts. Thank you, Mr. Chair.
Awesome. So in the budget, we need to put in those big blow up hamster balls for children.
Yes, but I want those just for fun. But yes, they could serve the purpose.
Ditto. I want it for fun, but I also want it so people don't touch me.
Yes, dual
See,
purpose.
we are getting somewhere today, guys. Wonderful. Thank you. That is a great idea. So these are all good ideas that we can talk about at the next one. Miss Debbi Moore, you do have your hand raised.
Yes, just in response to that Ms. Lopez, Debbi Moore for the record. Ms. Lopez, that is part of the discussion, and I would be happy to volunteer to work with staff to see if we can't find some people to make the presentation. And with that, Mr. Chair, I call the question.
Thank you, Ms. Debbi Moore. Okay, so we have a call to question, which is a motion on the floor by Ms. Debbi Moore, and it was a second by Mr. George Miller to table this until the next meeting where we can get better resources for a discussion. Can I get a roll call vote on this, please?
Yes, Mr. Chair. Ms. Debbi Moore?
Yes.
Mr. Michael Harris?
Yes.
Mr. George Miller?
Yes.
Ms. Sharon Thomas?
Yes.
Ms. Brooke Montgomery? Absent. Ms. Veronica Archuleta?
Yes.
Mr. Ron Fitzherbert?
Yes.
Mr. Doug Cowan?
Yes.
Ms. Susan Greenwald? Absent. Ms. Jolene Martinez? Absent. Ms. Darleen Lopez?
Yes.
Mr. Chair?
Yes.
Thank you.
Motion does pass. We will be putting that on the agenda for next week. With that being said as well, that concludes our discussion items and it moves us on to future discussion items with 2 minutes remaining as our goal. As we now have a discussion item being the childcare again, which we will get a better grasp on and get a better presentation in. I'll work with Miss Debbi Moore and we'll figure that out, as well as Miss Sharon Thomas, and we'll get some people on here to talk to us about possible recommendations to the City Council and Mayor. We do have on the agenda the Workforce Connection Scholarship. I know that we have pushed that off. Ms. Lopez, do we need to push that off another week or should we be talking about that next week?
Mr. Chair, actually, Griselda, I'll have to call in Griselda. I just sent over a request to Dahlia about us coming back together to discuss the structure for the volunteer. So I don't know what Dr. Martinez's schedule is like, so I don't know if we'll be able to get that concluded by next week.
Thank you, Ms. Lopez, for that information. We can get together, and because we will have to run it through our legal department, after we finalize the framework, I would recommend to have it the following week, if possible, to give us time to discuss it with Workforce Connections and then run it through our legal department, if that's an option for the board.
Okay, perfect. So it looks like time is going to be the biggest aspect of that one. I know that there was a lot of talk on small business and e-commerce and working through that. I don't know if that's something maybe we want to look at. Online, taking business online. I know that's a huge movement right now. Any other suggestions, or I'll have to brainstorm over the weekend? Mr. Harris.
This is Michael Harris for the record. Yesterday in one of the, I think the standard economic development policy meeting, there was a presentation about a business survey that went out. And it might be interesting to get maybe an abbreviated version of that presentation that we could see, or at least the slides. One thing that I was just watching it on YouTube, and one of the concerns that I had, and I think some other people voiced too, was that there was a pretty small sample that actually responded to the survey. But it might be nice, maybe not next week, but to get some more info from businesses about what they need, and from consumers about what they need. And I know that's a big ask from the city, as Dr. Martinez stated earlier. But it would, I think, help guide us maybe to come up with some more actionable items if we could get some more ideas from the people who are affected. I don't know if the chamber has some data about that that they could share too.
Debbie, I see your hand up. I'm sure you're. Go ahead, Debbie.
Mr. Chair, thank you, Debbi Moore, for the record. Mr. Harris, yes, and Darleen and I do serve on that PRC, Economic Development PRC, and I believe we should hear some of the, what I would prefer is maybe we can look through that and kind of fine tune that PowerPoint, as I heard some actionable items in there. We have done 3 or 4 surveys, and our turnout has been very low as well from the chamber standpoint. And just for the group to know, one of the things I voiced at the meeting yesterday, if you weren't watching it, it was the simple fact we've included, it was not even about what, 3%, Griselda, of the 3,000, I think it was like 95 responses, which is pretty much good, you know, a good survey. However, my point of concern is I always, when I do them, I try to pull out some of the home-based businesses. They maybe have a different concerns than the storefront businesses. So I think what I would recommend, Mr. Harris, that we put this off maybe another week until we can analyze and see where the PRC goes with the survey. And I believe the Griselda, you can help me. I believe this is going to be presented to the city council as well, the survey results, or not at the present time? No, not at the present time. So I think there is some actionable items, I guess is my summary, Mr. Chair, Mr. Harris. I just feel like maybe we need to research what really is applicable because as Ms. Lopez said a while ago with the childcare, when you talk about childcare, it could go long-term out of the scope of what our board is. But I think we need to look at a short-term, what is directly actionable that totally has been impacted and will continue to be impacted by COVID directly.
Mr. Chair?
Yes, ma'am.
Mr. Chair, Mr. Harris and Ms. Moore, yesterday's presentation, we can provide the slides as they are currently from the information we gather on the survey sent out. As Dr. Pallares mentioned yesterday, because the survey did not have the option of home base, that was one of the concerns from Ms. Moore, did not have that as an answer. we cannot cross-reference with the current results we have. So if the desire is to do more cross-referencing with that element, we would need to do another round of surveying rather than utilizing the numbers that we currently have. So we could do it twofold, present what we have, and as the plan is to do a monthly survey, and when we have the next month's information to present it again, or to send the PowerPoint presentations with the data.
Okay. Thank you for that. So am I understanding that we want to look at this ASAP next meeting, or Debbie, did we kind of think the week after?
Mr. Chair, what I would probably, we could certainly, sorry, Debbi Moore for the record. Mr. Chair, what I would probably recommend, and based on my conversations on that, in that committee, and also discussions with Francisco and Griselda, is we look at the slides, not take any action as it is. And I would say wait till a few weeks to see after they do it again, and maybe recommend that they do. I know I'm hanging on those words. I just have found in the past, home-based businesses typically have different needs than storefronts. And I think you need to separate that. That's just been my experience in my 30-year chamber world of doing that. So I wouldn't say next week, but maybe we can keep in touch with Griselda and her team and see where they're at. But I certainly send the slides out if that would be the pleasure of this board in its entirety. Thank you, Mr. Chair.
Thank you, Ms. Debbi Moore. Okay, so that works. So let's go ahead and distribute to the board the PowerPoint from yesterday's presentation. Get that done. Let's also, so we do have childcare, and I think that's going to be a pretty big one for next week. What I'm going to recommend, I think we need to just keep it to the one discussion item, get through that, and then I think we need to have a bigger conversation about future discussion topics. I will be sending it out in email over the weekend that I'll have Cynthia distribute for us to the board, because we need to come to the table next week with some new ideas on what we can be looking at. So that's going to be my challenge for all of you on here right now. I'm challenging you to go out there. You all represent an industry and or a sector of the economy, whether it is myself being a small business owner, or Debbie with the chamber, or Mr. Cowan with the nonprofit side. We need to come to the table with some ideas to talk about on this board. So I challenge you all to come up with those by the next meeting, because we'll be having a more lengthy discussion on future discussion topics. And I will get that email out to the rest of the board members that were not here today with us. So with that being said, that is what the next agenda will look like. Also, our next board meeting is the I believe our next board meeting is going to be the one that is at 1:30 in the afternoon. So please make sure that you have that on your calendar, that is the one meeting a month that gets changed to the 1:30 Thursday instead of 10 a.m. Thursday. With that being said, any announcements that anyone has for the board that relates to our ad hoc committee? Yes, Ms. Martinez.
Mr. Chair, I'd like to remind you all about I believe I mentioned this before, the technical assistance partnership we have with Live Fund that would lead to a micro lending. That work is currently underway. So we have somebody who has been hired, a Live Fund staff member, who is now the person here in Las Cruces dedicated to help us with that work. There was a webinar yesterday in English, and today there is a webinar in Spanish. So if you could help us distribute that. For yesterday's webinar, there were 25 businesses or people registered. For the Spanish-speaking segment, it's a little harder to get people engaged. So if you could help us distribute that information, will be very helpful for all of us.
Definitely. If you'll distribute that through email to the board so we can send it out on our email list, I think that would be great. Any other announcements, whether it's from staff and or board members? As seeing none, I entertain a motion to adjourn. Someone wants to make the motion.
This is Michael Harris. I'll motion to adjourn.
We have a motion from Mr. Harris to adjourn the meeting.
This is Veronica Archuleta. Finally said something.
Veronica with a second.
I'm listening. I'm
I
listening.
did it.
Oh, I did it.
Keep here. Anyways, we have a motion in a second and we are adjourned, everyone. I will see you tomorrow or next week at 1:30 and we'll get some email communications out in the meantime.
Mr.
Have
Chair,
a great afternoon.
May
Yes,
I
ma'am.
go for the final vote on the adjournment?
Oh, sure. Yes, ma'am.
Okay, Debbi Moore,
She is no longer here.
absent. Mr. Michael Harris,
Yes.
Mr. George Miller, absent. Ms. Sharon Thomas,
Yes.
Ms. Brooke Montgomery, absent. Ms. Veronica Archuleta,
Yes.
Mr. Don Fitzherbert.
Yes.
I'm working here with my screen. I apologize. Mr. Doug Cowan. Absent. Ms. Susan Greenwald. Absent. Ms. Julian Martinez. Absent. Ms. Darleen Lopez.
Yes.
Mr. Chair.
Yes, ma'am.
Thank you.
Okay. Adjourned. Everyone have a great evening.